Ziana Gel is a combination medication used to treat acne. It helps to reduce the number and severity of acne pimples and also helps the pimples that do develop to heal more quickly. This gel contains tretinoin, which belongs to a class of medications called retinoids and works by affecting the growth of skin cells. It also contains clindamycin, an antibiotic that stops the growth of bacteria that cause acne. It is recommended to apply a thin layer of Ziana Gel to the affected area once daily in the evening, after gently washing and drying the skin. It is important to avoid using this gel near the eyes, mouth, and other mucous membranes. Remember to use sunscreen and wear protective clothing while using Ziana Gel, as it may make the skin more sensitive to sunlight. Always follow the instructions given by your healthcare provider and consult with them for the best timing to use this medication. Before you start using Ziana Gel, make sure to read the patient information leaflet if available from your pharmacist. If you have any questions, ask your doctor or pharmacist. When applying Ziana Gel, wash your hands first and then gently clean the affected skin with a mild or soapless cleanser. Pat the skin dry and use your fingertips to apply a small amount of medication in a thin layer over the face as directed by your doctor, usually once daily at bedtime. Be careful to avoid the eyes and lip area. Remember to only use this medication on the skin and not on the inner lip area or inside the nose or mouth. Also, do not apply it to cut, scraped, sunburned, or eczema-affected skin. If the medication gets into your eyes, flush with large amounts of water and call your doctor if eye irritation develops. Wash your hands after using the medication to avoid accidentally getting it in your eyes. During the first few weeks of using Ziana Gel, your acne might appear worse because the medication is working on pimples forming inside the skin. It may take several weeks to notice results from this medication. To get the most benefit from Ziana Gel, use it regularly at the same time each day. Do not use a larger amount or use it more often than recommended, as it will not improve your skin any faster, but it will increase your risk of redness, peeling, and pain. If your condition lasts or gets worse, be sure to tell your doctor. During the first 2 to 4 weeks of using Ziana Gel, you may experience skin redness, dryness, itching, peeling, mild burning/stinging, or worsening of acne. These effects usually decrease with continued use. If you have very dry skin, a daytime moisturizer may be helpful. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Your doctor may want you to decrease how often you use the medication or stop using it. It's important to note that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you have any serious side effects, such as blistering/crusting of the skin, severe burning/swelling of the skin. Ziana Gel may be absorbed into your bloodstream and very rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur during treatment or weeks to months after treatment has stopped. Tell your doctor right away if you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, blood/mucus in your stool. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Ziana Gel, it's important to talk to your doctor or pharmacist about any allergies you may have to clindamycin, tretinoin, lincomycin, or other vitamin A-related drugs. This medication may contain inactive ingredients that could cause allergic reactions, so make sure to discuss this with your pharmacist. Be sure to also inform your doctor or pharmacist about your medical history, especially if you have certain intestinal problems or eczema. Ziana Gel can make your skin more sensitive to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Weather extremes such as wind or cold may also irritate the skin, so using sunscreen daily and wearing protective clothing when outdoors is recommended. If you get sunburned or experience skin blisters or redness, be sure to inform your doctor. While using this product, it's best to avoid electrolysis, waxing, and chemical hair removal on the treated areas. If you've recently used products containing sulfur, resorcinol, or salicylic acid, you should use Ziana Gel with caution and wait until the effects of these products on the skin have decreased before using this medication. Before having surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Ziana Gel should only be used when clearly needed, as it may harm an unborn baby. Be sure to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding while using Ziana Gel. It's important to be aware of potential drug interactions with Ziana Gel. It's best to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any serious side effects. Also, avoid using other harsh or drying skin products on the treated area, such as hair perming solutions, alcohol/lime/menthol containing products, medicated or abrasive soaps, and products containing sulfur, resorcinol, or salicylic acid. It's also important to talk to your doctor or pharmacist before using benzoyl peroxide products at the same time as Ziana Gel, as it may decrease the effectiveness of the medication. If someone accidentally swallows Ziana Gel, it can be harmful. If the person shows serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share your Ziana Gel with others. When it comes to cosmetics and soaps, some may actually make your acne worse. However, moisturizers are generally safe to use. When purchasing cosmetics, moisturizers, or other skin care products, make sure to look for the labels non-comedogenic or non-acnogenic, as these products are unlikely to worsen your acne. It's a good idea to ask your doctor or pharmacist for recommendations on which products are safe to use. It's also important to remember that acne is not caused by dirt, so cleaning your skin too frequently or vigorously can actually irritate your skin and make your acne worse. If you forget to use Ziana Gel, use it as soon as you remember on the same day. If you don't remember until the next day, then wait until your next scheduled dose. When using Ziana Gel, it is important to store it at room temperature and away from light. The gel is flammable, so it should not be exposed to heat or fire sources. It should also not be frozen. It is important to keep all medications away from children and pets. When you no longer need the product or it has expired, it is important to properly discard it. It should not be flushed down the toilet or poured into a drain unless instructed to do so. It is best to consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.